There was a woman, she was 8 months pregnant, and she developed a fever, and she also developed loss of taste and smell. She had no known previous health problems. She took a test for COVID-19, which came back positive. A couple of days later, she began to develop severe difficulties breathing, and her partner called an ambulance, and she was admitted to hospital. She was in the intensive care unit. 3 days later, she gave birth to a healthy baby boy. However, after the delivery, the woman's health declined rapidly. She was put on a ventilator and remained on a ventilator for 22 days. She subsequently died of respiratory failure as a consequence of pneumonia. So how do we fill out the death certificate in this situation?
Colleagues, you can unmute yourself, huh? Please.
This Imelda here, can I try?
Sure, go ahead.
I want to say that the immediate cause of death in A as the pneumonia.
Mm-hmm.
And then the pneumonia, though the duration of the pneumonia, was it the one which was, had it been on for almost the entire 22 days she was on the ventilator? That one we need to clarify. And then the B, I would like to put COVID-19 as D. But when it comes to coding, this was, I would love to put that COVID-19 related death, that code in the category where it had been tested positive. That is the 098.5, is it U07.1, where there was a positive test.
Wonderful.
Is that acceptable?
It is. And what would you do at the bottom of the death certificate as well? The important thing we need not to forget.
Okay, the pregnant at time of death, no, she was not. She had delivered. She had delivered B. She was not pregnant at that time, but she was pregnant for 42 days.
Perfect.
Because she died, she spent 22 days on the vent, but had delivered a live baby.
Wonderful.
That's what I think.
Great. So that matches up very closely to what I put as well. So I thought that was great. Exactly as you said. So I put acute respiratory distress syndrome as the immediate cause of death, but that will differ slightly according to country as to how that's recorded. As a consequence of pneumonia. As a consequence, exactly as you said, of pregnancy complicated by COVID-19. And that is the underlying cause of death, exactly as you just said, which is what's important to us from the purposes of ICD-10, because that's the broad category that we use when we're tabulating single causes of death. And you actually gave fantastic detail, which I didn't in terms of the actual ICD code. You're absolutely right. She had a positive test from the lab. So you could use 097.5, U07.1 to signify that she had a positive test. That was wonderful. Perfect answer.
But I have a question here, again. Regarding what has been put as the immediate cause of this, acute respiratory distress syndrome, there are times when they will tell us that at times putting respiratory failure, when you put cardiac failure, that usually is not acceptable. I don't know, here we put acute respiratory distress syndrome.
So this is the, yeah.
Acceptable.
So I would follow the guidance that you've agreed regionally in terms of the immediate cause of death. This is the example which is given in the coding note. You know, the one that I showed you on the previous slide, the WHO coding note from their quarters, in terms of how to classify COVID deaths. So this is what we're recommending globally. But sometimes different areas differ slightly in terms of the immediate cause of death. And my speciality is the underlying cause of death, which is pregnancy related by COVID-19, complicated, by COVID-19. So yeah, follow what Hilary and Benson told you regarding the intermediate cause of death, if that's what you're doing in your region.
I have a question relating to that. So when we have a COVID patient that needs intubation and we're failing to intubate, or we're failing to ventilate because we don't have enough ventilators, how do we code that?
Do you mean generally or in?
So we're attempting the intubation, but we're not physically able to intubate for whatever reason.
I'm not a respiratory specialist, so I couldn't tell you whether there's a specific ICD code to distinguish. If the woman was pregnant, then that could certainly be a pregnancy complicated by COVID-19. But you'd need to go to, I think it's already been shown to you, but you know, there's a very large list of all the possible codes that you can use online. So you'd need to go on there to see whether there was a specific code for failure to intubate.
To me, I think that the failure to intubate would be a contributing factor, because that is not what is causing the actual death. You may find that they are becoming asphyxiated and so on and so forth. So the failure to intubate is contributing to what is actually causing the death. That's what I think.
Yeah, but B, I think B is also, I could sense it. I'm overthinking. There's an element of ethics as well here. Like you want to intubate, but there are no beds available or no ventilator available. Then what? I don't know if I got you correctly, B.
That's what she
There are
said.
two scenarios. The one is that if I were able to ventilate the patient would survive.
The assumption.
The second element is I'm actually physically attempting the intubation, but due to epiglottal stenosis or whatever, due to swelling in the airway or due to secretions, I can't visualize the airway and I'm failing to intubate. And because I'm failing to intubate to put the patient onto a ventilator, the patient is dying of hypoxia.
Yeah.
Okay. Then there's a third one where.
So the one is a physical inability of me to do it. And the other one is the ethical component of the equipment is not available because it's that system interruption that we spoke of earlier. So the one is the system interruption, which I'm not talking about, but the second one is I'm physically attempting the intubation, but I'm failing. And because I'm failing, the patient is dying of severe hypoxia.
Okay.
I think, I mean, that's a really important distinction. With the first example, where it's the bed's not available or the ventilator's not available, that's something which can be written in the other significant conditions. And in ICD-MM, you'll see I can't remember exactly what the example is right now, but there's an example somewhere where failures in the pathway of care, things not being available, a woman not attending antenatal care and so on were recorded there. It's not information that we use when we're doing mortality statistics on the underlying cause of death, but it is obviously really important at the more local level, and it's an important contextual factor. Yeah, with the other one, you'd need to look at the specific. I don't want to tell you the wrong thing, and it would be specific in terms of whether there is that code available in the respiratory section or not.
Just have a question. Is it possible to give an opportunity to see that, like this example, to really go to that coding and you see how we can pull out this information, and then from there we can explore and see whether there are any other options for codes, like in case there are system interruptions, do they have a code? Like in that case, if the ventilator was not available, in their situation when at times maybe dialysis is not available, I don't know whether that one is catered for, whether there are codes for checking out system interruption, which may be a common factor in some of the developing countries for some of them.
So systems factors normally aren't given ICD codes in the same way. It's normally it's normally something which isn't aggregated up in terms of ICD. It's something which is more discussed at the level of an MPDSR. In terms of, I can't remember which set of slides it was, but they were one of the ones you shared to me from the earlier presentation when either Hillary or Benson went to the website. Maybe he didn't directly go to the website, it might have been screenshots. He showed how you can type things into the website for ICD 11. Do people recall that? Or?
Yeah.
So on ICD 11, because I checked this, because we had this case on Sunday, and I checked this in our assignment. So there is a code, I think it's a J code, failure to intubate. And I just wasn't too sure in what order am I placing it, or whether the failure to intubate actually comes in as, whether I need to consider that as a code, or whether I just do the coding as you have done on your screen currently. But there is a J code for failure to intubate. And in fact, there's a code that says failure to intubate in the purperium, which is then the code that I picked for the example for the assignment.
Okay. So the way you know it, or so in terms of the order, the important thing is the interval between onset and death. If for this particular example, pregnancy complicated by COVID-19 is always going to come first before the failure to intubate. So that would still be the underlying cause. Because she must have had the pregnant, like you would assume that she contracted COVID and her disease worsened and so on before you actually got to that point. So it may affect what your intermediate cause of death was, I suppose, but in terms of the underlying cause, that would still be pregnancy complicated by by COVID-19. Sorry.
Okay.
So underlying cause will still be the complication by COVID.
Exactly, and that's what's the most important thing.